was a study that was aimed at confirming and extending some findings that we had reported a few years back with a group in the U.S., where we found in the group in the U.S. that we had certain inflammatory factors that were different in the gut, in the stool of Parkinson's patients compared to their spouses. And we wanted to confirm that. And so we did another study in Finland with a collaborator, Dr. Phil Shepard-Jans, and we found in a small group of patients, 55 Parkinson's and 56 healthy controls, where we were comparing not just the stool cytokines, but the plasma cytokines and also the clinical features of the PD patients. And we were looking to see whether we had differences between males and females and whether we could find any correlation of the stool inflammation or the plasma inflammation with any clinical features. And what we found, very interestingly, is we found that in the females with Parkinson's, they had higher prevalence of gut inflammation. And in males with Parkinson's versus no Parkinson's, they had lower short-chain fatty acids. And then, interestingly enough, in the Parkinson's patients with gut inflammation, they started showing the disease symptoms earlier in age. While the patients that had higher the short chain fatty acid levels, they were older when their symptoms appeared. And so it seems that there's a correlation with, the level of short chain fatty acids and the ability to, show symptoms. And so we think also that our study suggests that certain kinds of bacteria that are producing the short chain fatty acids may have affected the patients with Parkinson's differently than the healthy controls. So these are still correlations. You would have to probably manipulate those bacteria and the bacterial-derived products that are coming from them to directly establish the causality. But we think that the implication is there that the amount of short-chain fatty acids and the effects on inflammation are important to look at, and that the levels of inflammation in the gut are not reflected in the plasma. So we need to be careful when we're looking at levels of inflammation in patients that we might want to be measuring those in the stool, not necessarily those in the plasma.